Welcome to the Gum Guru, the podcast where we talk about all things gums, implants, and oral health. In each episode, Dr. Macon Singletary of North Raleigh Periodontics shares tips to keep your teeth and gums healthy.
Welcome to the Gum Guru podcast. Thank you so much for being here with us today. I'm Jason Kong, and I have the pleasure of being here with Dr. Macon Singletary as well as Dr. B back with us again. We've got a great show lined up today. We're going to be talking about what Dr. Singletary and Dr. B are actually looking for when they look in your mouth. And before we get to that, Dr. Singletary, we just passed Memorial Day weekend. I hope your summer's off to a good start.
Going fast. But it'll be Christmas.
It's scary to think that in a few months we'll be there. Dr. B, I hope your summer is off to a good start as well.
Yeah, can't complain. It's been nice and warm, and can't wait for the cool weather to come back.
We're already waiting for that. We're already waiting for that to come back in effect. But let's get to the heart of our show now, and let's talk about Dr. B, we introduced you on our last episode, and I think that this is a good chance for folks to learn some more about you. So, when you have a new patient and you're doing that first initial exam, checking out a mouth, what are you actually looking for?
Yeah, I think before we even start in the mouth, that's kind of where we start. A lot of it is just learning about the patient, taking the time to really understand what their main concerns are. But beyond that is really looking at their medical history, understanding what other factors there could be going on in terms of their habits, medical conditions, medications that they're taking. It almost, we try to make it more of a conversation with the patient, I think, instead of more of an interview style. But a lot of that comes from, the patient, what they fill out in their charts. Some feel like it's repetitive, but it's always nice to just hear the patient describing what's going on instead of just reading it off the, new patient forms or whatnot. So that's generally where the first point of, what we're doing for the examination doesn't start in the mouth. It starts outside of the mouth with that conversation and learning more about the patient as a whole.
That makes a whole lot of sense. And Dr. Singletary, when we do peek into the mouth, where does the expertise of a periodontist come into play? How is that different from what a dentist might be looking for?
Dentists are trained to diagnose decay, periodontal disease, root canals, but general dentistry sort of is problem focused. They see decay, they fix it, do a crown, they fix it. And periodontal disease is multifactorial. There are many things that can affect your ability to heal. And so we look at three things. Basically, we look at the x-rays, the medical history, as Dr. B was talking about, and then their intraoral exam. But we can tell a lot just sitting down and talking to the patient, try to get a relationship, develop a relationship, because gum disease is not in and out. It's an ongoing process, and helping the patient understand that is probably the difference between our exam and, say, a general dentist exam. The reason why I went into perio is because I wanted to be good at something, and I didn't think I could be good at doing crowns and root canals and ortho. And by the way, I think ortho is magic. Moving those teeth through the bone. I thought I did what pop out of the head if I did that. So, but with gum disease, periodontal disease, it involves a lot. And there is it's a medical component, there's a psychological component. And that's the relationship that we try to develop here in North Raleigh Perio, is when they come in, we want to get to know the patient, and then we start the exam. We take photos, we do bacteria sampling. And we get the patients, they come in, they got a problem right off the bat. Generally, most of the time they'll come in, it's this right here. Now, it could be burning up in their mouth, but that right there is what we got to address. And we do. In the meantime, we figure out what else might be going on with them. So it's not a one and done thing. It's an ongoing. As soon as they walk out the door, whatever we do here, when they walk out of the door, that bacteria is growing back. And so we got to help them understand that. And that's just not one simple conversation, one appointment. It's over a period of time. So we have to develop a relationship. That's why I like, Dr. B coming on board, because he knows how I think. We want to make sure the patients, when they call the office, they're going to get a human being. They're going to get somebody on the phone. They're not going to get a recording. They're going to get somebody that they can call on the weekends, because it is a relationship. And I think Not that general dentists don't do that, but I'm just saying with this day and age, it gets complicated. We're trying to keep it simple, but also patient focused.
Now, you two are both doctors, but you're also patients. And I think that we've all had that experience where that relationship component is kind of missing and you kind of feel like you're being sped through the process. So I think that's key. And I know as a patient, I appreciate that in-depth feeling and knowing that like we're on this journey together. That being said, Dr. B, when you do look in a patient during that exam, is there anything that can kind of immediately jump out to you? I mean, Dr. Singletary said that, oftentimes the patient kind of knows like, hey, this is what's troubling me. But when you do that initial exam, like what are the things that might jump out at you?
Generally when we're doing the exam, the first thing we'll do is take a set of photos, intraoral photos, just so we kind of have a baseline of where things are. And when we do the intraoral photos, we're trying to look for, and basically the same thing as us taking the mirror and looking in the mouth. But the things that I look for right off the bat is there buildup around the teeth? Is there that plaque or that hard calcified calculus around the teeth? What is the tissue looking like? Is it kind of a nice coral pink color that we're looking for? Is the tissue looking firm? Or is it more of kind of a swollen, purplish, bluish kind of appearance and puffy? Those are kind of things that we look off right at the bat. That's kind of stuff we see without even doing any measurements. And that can kind of already hone us in as to where things are headed or what things might be going on. And of course, like Dr. Singletary said, most of the time patients come in saying, hey, I need something on this tooth or the upper left is hurting me. So, we usually will tell them, we'll take a peek at that, but, we still got to take a comprehensive look at the overall gum health because, something might be hurting you in the upper left, but there could be something from the upper right that's triggering that or, contributing to that. So, first, it's always that visual assessment of what's going on. And then after that, that's when we get into kind of our clinical examination. I think Dr. Singletary likes to call it our medieval torture device as a joke to our patients, but it is just a very thin periodontal probe or fancy measuring tool, that ruler that we use. And what we're trying to measure is the pocket depths around the teeth. That's kind of our first critical quantitative way of assessing the patient's health or disease status. And then there's other measurements along that lines, and that's what we kind of have to chart, dictate, and that way we can kind of then document and compare over time as we build the relationship with the patient. That's something that we're checking at every single periodontal exam. And we can then show the patient, hey, this is where we see improvement. These numbers are going up, these numbers are going down, or this is where something's staying the same, or actually something's gotten worse. And without having a baseline assessment, we can't really, have those meaningful conversations. And from a patient's point of view, if you start to see improvement, and you see those numbers go from numbers that we don't like, which is 6 and higher, to numbers that we do like, 1s, 2s, 3s, maybe some 4s, you start to feel some, ownership of your health. You start to feel motivated by that, and you start to see, hey, things are getting better. I'm doing what I'm supposed to be doing. And so it's kind of a, we're periodontists, but we're also part-time psychologists, I feel like some days, trying to help motivate, cause some habit change in patients, and just keeping them wanting to come back and take care of their oral health.
Yeah, that's the name of the game. And, you guys both have your expert eyes that you can rely on. But what are some of the things as patients that we can look for that, jump out at you guys, but maybe don't necessarily jump out to us?
Well, very good question. I had a patient today that it was an implant check, yearly implant check. And generally, when we do implants in patients, we make sure that they're not overly susceptible to periodontal disease, because if you lose a tooth due to periodontal disease, you could lose an implant. And this individual, had good bone health, I'd say bone level, not really susceptible to aggressive gum disease or reacting to the bacteria. And I asked him, I said, well, how many times a day you brush? And he said, a couple, twice. How often do you floss? Well, maybe once every 2 or 3 days. And he has an implant that we put in a year ago, and I told him you brush and floss 4 times a day. But anyway, I said, okay, but he had myasthenia gravis and he had some medical issues, but he can use his hands. And so I started flossing, and I said, you're going to floss, you're going to eat twice, once during the meal and once afterwards when you floss. And when I went to his implant, which is what he was there for me to assess, where it was the implant, the general dentist was cleaning his teeth every 6 months. But his oral hygiene, he didn't feel it. There was, he said he felt, I went in, how things went great, any sensitivity, any concerns. And he said, no, everything's fine. And when I went to the implant, flossed it, barbecue came out. I mean, it was lunch there. And I showed it to him, and I said, this will make the implant fail. You've got to floss. He didn't feel it. And so when we eat, we can get food caught in between our teeth, and we don't realize it. Now, some people will. Some people who've been here long enough, they get real fanatical about, oh, I floss every time I eat, because I sort of browbeat them into it. But, but he just, I didn't feel it. I didn't know it was there. I said, yeah, and it was bleeding. And so that just food impaction, they may not be aware of it. And then another thing that they may do, it may not hurt, but if they do notice bleeding, they'll back off. They'll say, I thought I wasn't, it was bleeding. I didn't want to mess with it. That's the worst thing you can do. If it's bleeding, there's a reason you should go, don't hurt yourself, but go after it. But yeah, the main thing is every time you eat, the bacteria grow exponentially for 30 minutes. You don't know that. You don't see it. You don't feel it. I always say, if something's going on, it's like high blood pressure and glaucoma. If it hurts, it's curtains. So that's why it's so important to stick close to your dentist or periodontist, and make sure you stay on a good maintenance program, because there are things there that will crop up. And if it's hurting, it may be too late.
Yeah, and that's a scary thing for all of us. We don't want to be in that position where we've ignored something or let things get to a point where it becomes an emergency. And I love that you brought up the aspect of gums, because that's so critical to what you do. But let's talk a little bit about what healthy gums look like and what gums that aren't healthy look like.
Yeah, just from a visual assessment, a couple of things we look at is like the color of the tissue, the color, consistency, contour, texture. So healthy gums kind of have that, I call it coral pink or salmon pink looking appearance. They kind of either we describe it as kind of a knife edge or rolled margins, or basically where the gum and the tooth interface kind of meet. Other things we look for, sometimes you might see that orange peel appearance. That's called stippling. Sometimes it's there, sometimes it's not. If it's not there, that doesn't mean the gums aren't healthy. It's just sometimes in health, we tend to see that more often. So that's kind of those assessors that we're looking for health. In some of the more disease or early signs of disease, what we'll see is kind of that puffiness, swelling, edema. We'll see kind of that reddish hue around the teeth. Sometimes that can become more of a purplish situation, and things just look angry. That's kind of one way of describing it. It's kind of almost like you can stare at the teeth and the gums and they'll start bleeding. So when you see those sort of things, those are things like Dr. Singletary had mentioned, like it may not be hurting, or it may be hurting, depends. Each patient's different, but you might just be avoiding it. Or if it is hurting, you kind of back off from it, and it kind of starts a vicious cycle of where you're just allowing this inflammation to kind of progress or continue in a site by not getting at it, and then you're kind of continuing that cycle because it's just happening nonstop because you're not getting at it. So other things we would notice as well from patients is they might start to notice some sensitivity in certain areas. That's a common reason that they come to us, or they start having weird funky tastes, like a metallic-y taste in their mouth, and or they're just having pain in general. But the biggest things I would say probably that they're not noticing is just maybe that puffiness, swellingness, until it gets to a point that it's starting to hurt them.
And I've done this show enough times with you, Dr. Singletary, to know that, when there are issues with our gums and our mouth in general, it's not just isolated to that area. That can lead us susceptible to some pretty serious illness and disease.
Yeah, there's an oral systemic connection. When you have a normal complement of teeth, the surface area exposure to the cardiovascular system size of your hand. Every time you chew, you have bacteria showers in the bloodstream. It takes a minute to go from your mouth to your toes. So, but that's one aspect, oral systemic, but also just there are things that, like Dr. B was saying, a metallic taste, or dry mouth. There are things that we see when we do an exam, there could be a medical problem, diabetes, autoimmune diseases, Sjogren's syndrome, that can affect the salivary gland. So there are things that we will be able to determine with our examination. But yes, the inflammatory mediators, when we respond to the bacteria, it affects the heart. Those interleukins and bradykinin are fancy words, but they irritate the arterial linings and cause atherosclerosis and cardiovascular disease. There's a spirochetal organism they found in the brain producing amyloid, and it's causing dementia. It comes from plaque. So even though it doesn't hurt and you don't feel it or know it, there's things that when we do the exam, we can determine, just off the bat, the metallic taste, it can be a vitamin deficiency. Burning tongue, same thing, could be a pernicious anemia. So there's so many things that, ignorance is not bliss. Just tell us everything that you're feeling. Sometimes they'll come in and my assistant will start writing things down. And then I springboard into it. But it is important to understand that there is a systemic connection. And if during COVID, it's unfortunate, but we were told to shut down only for emergencies. And periodontal disease, that's inflammation. And if you have an abscess or something going on with a tooth, it can go to the brain. And I was busy. I got called up and somebody said, "Why are you open?" I said, "Well, I'm a periodontist." She said, "Well, you're supposed to be closed." "Well, we shut down the hygiene." I said, "Well, why'd you go into healthcare? We're here to help people. If you're concerned about COVID or, there's HIV, there's AIDS, you ought to go into computers. I'm here to help the patient." But I had one patient end up in the hospital. She didn't come in, but she had an abscess. And she ended up having a brain that she was in the hospital because of that. So even though you don't think about it, it's significant. And that's why I say emphasize so much, you can't brush and floss too much. It's simple. You know what's free?
Yeah,
flossing and brushing.
It's so true. And Dr. B, I know you have to have examples as well of how, this systemic approach is really critical that you take that, but for us to be aware of it as patients.
Yeah, definitely. Dr. Singletary was saying, a lot of these patients, I think they recognize that there's something going on with the mouth, but they don't make the connection fully that what the systemic considerations of that could be. And unfortunately, with periodontal disease being just this low-grade chronic inflammation, it doesn't hurt until it hurts. And then by that point, we're then kind of having to play catch up a little bit to get people to stability. But that's kind of when, if you come to us right away, we're able to kind of get you back to a state of stability. And, we work with a lot of great referring colleagues who are really keen at finding those patients and figuring out which patients are the correct patients to send to us and which patients they're able to manage. And I think that is a huge, huge benefit, having those colleagues who know when to send, when not to send, who they can manage versus they know, hey, this is actually kind of out of my scope. Let's get you to, North Raleigh there, to North Raleigh Perio, and have them take care of these things to manage it much better. And then working hand in hand with them. So it's a team sport, essentially. That's what dentistry is ultimately at the end of the day. We play one part in it I tell patients, our part is the bone and the gums and the foundation of the teeth, kind of like the foundation of the house, but we also do need the general dentist to help us out. And the patient needs a full team around them. You can't just rely on one person ultimately. So
very well said. Well, on the Gum Guru podcast, we always love to have an action step that we all can take. And Dr. Singletary, what is our action step for this episode?
Well, Dr. B touched on it. It's just make sure you stay connected with your dental professional. Don't ignore it. Get an examination to cleaning twice a year, because even though you don't feel something's going on, they'll be able to see it. Head it off to the past. It's always less expensive and cheaper to catch it early on than later on.
Well said. Well, if you're here with us, maybe you have noticed something, or there's something that has caught your attention in your mouth, and we want you to take the next step. Get a hold of Dr. Singletary or Dr. B. You can go to NorthRaleighPerio.com. Be sure to subscribe to the Gum Guru podcast so that you can get the first edition of new episodes as they come out, get those alerts and notifications so that you can learn more ways to keep your mouth and your body healthy. Well, that's going to do it for us today. On behalf of Dr. Macon Singletary and Dr. B, I'm Jason Kong. Thank you so much for listening and watching the Gum Guru podcast.
Thanks for watching. Be sure to like and subscribe so you don't miss more tips to keep your mouth healthy. Learn more by visiting NorthRaleighPerio.com.